What is encopresis, soiling, and how does it relate to potty training? Have you ever heard of encopresis? This condition can be quite concerning for parents and toddlers alike. Encopresis, also known as stool soiling, is when a child unintentionally leaks stool into their underwear. This often happens to children who are 4 years old or older and have already learned to use the toilet. It is frequently linked to chronic constipation and difficulties with bowel movements. So, how does encopresis develop? When a child holds in their bowel movements, it can be due to pain or fear associated with pooping. As a result, stool builds up in the rectum and colon. The colon absorbs water from the stool, making it harder and larger the longer it stays inside. This can stretch and weaken the muscles and nerves in the colon and rectum, making it painful for the child to pass stool. You may notice your child trying to avoid pooping by crossing their legs or holding themselves tightly. Over time, the rectum can become so full that the muscles controlling stool releases cannot hold back softer stool or liquid. This can lead to leakage, causing the child to soil their underwear without even realizing it. Now, let's talk about how encopresis relates to potty training. It often occurs after a child has been successfully potty trained, which can be confusing for parents. Sometimes, if a child experiences painful bowel movements during potty training, they may start to withhold stool to avoid discomfort. This can create a cycle of constipation and soiling. Several factors can contribute to this issue. For instance, fear of the toilet, lack of privacy, or not wanting to stop playing can lead to withholding stool. Changes in diet, dehydration, illness, or emotional stress can also increase the risk of constipation and encopresis. As a parent, it is essential to recognize that encopresis is not intentional misbehavior. Children often feel ashamed or embarrassed about soiling accidents. Supporting your child with patience and understanding is key. Encourage regular bathroom routines and provide a comfortable, private space for them to go. Make sure your child has a diet rich in fiber and drinks plenty of fluids to help prevent constipation. If you notice signs of withholding stool or painful bowel movements, it is a good idea to consult a healthcare provider for guidance. Treatment may include stool softeners, behavioral strategies, and sometimes medical evaluation for underlying causes. Understanding encopresis can help parents navigate the challenges of potty training and manage soiling issues effectively. By creating a positive and supportive environment, you can help your toddler feel more comfortable during this important stage of development.